Almost 30 years after the first camps were set up in the rainforest along the border between Myanmar and Thailand, they are still inhabited by thousands of refugees. Over the years, hundreds of thousands of people have fled from Myanmar to Thailand because of violence and persecution in their home country. The political climate has, however, changed in Myanmar, and the ongoing dialogue between the government and ethnic groups in the country may create viable opportunities for return in the near future. The camps are mostly located in the forest near the border between the provinces of Mae Hong Son in northern Thailand and Ratchaburi, just a couple hours west of Bangkok. Currently, there are 9 camps along the border with a combined population of slightly more than 100,000 refugees. Many have lived in the camps for several years and some for decades, while others have been resettled abroad. Only some of the camp inhabitants have been afforded official refugee status, and a significant proportion continue living in the camps as unregistered refugees.
Nó khóc rồi bộ lên thì là có vấn đề được đã hỗ trợ cái nó bộ thì thì nhau đồng qua hỗ trợ phải là vào lên đây qua vũ nó lên phải lên đây qua vũ này nó bộ đã bộ Việt Nam là về rệt lên đã lên bộ là đi tôi là người ta mua ở bộ này đó là số đã bộ này là bộ qua cái là ta sai ở ở đó ta sai được lệ lên bộ này kẹp được kẹp bộ phá đồ nhá là nó có sao gọi mình lấy bút bia gọi mình đó bà chú bà sai sơ tỏ ra phải thọ bà lỡ ta sai phụ đó về này mình ta kẹp được kẹp phụ lấy về phụ gọi đồ mà này nó tập được là.
Most of the support services in the camps are run by international non-governmental organizations. Some provide food, shelter, or education, while others like Malteser International provide basic health care along with water, sanitation, and hygienic services, usually referred to as WASH. Most of the refugees have little or no chance of leaving the camp to make a living. Inside the camps, income-generating opportunities are very limited. Most of the younger residents have spent most of their lives in the camps and are not well prepared to return to Myanmar. They depend heavily on daily services and support provided by the organization that support the camps in Thailand. Since the camps are mostly unprotected forest areas and the refugees are supposed to go back to their home country at some point, their buildings have been built in a way that allow for easy dismantling and removal. This is why they are referred to as temporary refugee shelters by the Thai authorities. To maintain these standards, Malteser International has constructed hospitals and support facilities accordingly, mostly using materials like wooden poles, bamboo, and corrugated metal sheets. In the 2 refugee camps, Mae Ra Ma Luang and Mae La Un, Malteser International delivers basic health care services to nearly 23,000 refugees. Trained medics and nurses, camp residents themselves, provide basic treatment for refugees, as well as members of the Thai population living around the camps at 4 outpatient and 2 inpatient departments. Malteser International regularly trains and supervises them and other camp staff in their tasks. Thus, the refugees are to a large extent able to run most of the basic operations inside the camp on their own. All training is monitored and evaluated through a system of tests and final exams. Currently, more than 300 camp staff members are employed in the 2 camps. Malteser International gives technical guidance and support planning and procurement to facilitate the work of the hospitals. This way, the refugees themselves provide most of the services independently to their peers, which has created crucial confidence in the operation of these facilities, as well as giving them the necessary skills and capacities to deliver these same services once they return to Myanmar. All hospitals are equipped with a delivery room, pharmacy, and laboratories. Labs attached to the hospital can carry out basic blood and urine tests to screen patients for diseases. Malteser International also treats people with chronic diseases by providing routine checkups and medication. Due to the remoteness of the area and the lack of infrastructure, it is not possible to manage emergency, life-threatening, or complicated cases in the basic camp hospitals. To do this, Malteser International immediately refers such patients to Thai hospitals in Mae Sot or Chiang Mai, around 2 to 4 hours drive away from the camp. Malteser International also runs eye and dental clinics in the hospital compound. With the support of Suwamanit Foundation, Malteser International conducts cataract operations mainly for elderly residents on a yearly basis. The eye clinic staff also checks the sight of visually impaired people and provide eyeglasses. Oral hygiene is one of the major problems of the refugees, as it is often neglected from childhood. Thanks to the support of the German dentist Dr. Ulai Reiter, Malteser International was able to purchase a dental chair and modern equipment to enable tooth extraction and fillings performed by trained personnel. In addition, Malteser International employs dental health workers who promote good oral hygiene practices in schools and refers children with toothaches to dental clinics.
I have been working as a medical doctor in Malteser International Can Hospital in Luang, Can for 1.5 years already. During my working here, the most common diseases I have seen are upper and lower respiratory tract infections, skin diseases, watery diarrhea, urinary tract infections, and we have other diseases like epilepsy, hypertension, DMs. And we can manage some diseases in our camp, but sometimes we have to refer to Thai hospital for the secondary care services. And I love working here, and I will continue to work with Malteser International Camp Hospital as long as Malteser International Hospital is staying in this refugee camp.
In 2015, Malteser International also started providing psychosocial care for camp residents that need it. Many refugees experience domestic violence, are traumatized by conflict, or are afraid because of uncertain political situations they may face returning to their home country. Trained lay counselors discuss and listen to the patient's issues in a comfortable and non-judgmental environment. Healthcare services for pregnant and lactating women, as well as children under 5, are very important to ensure the safe delivery of children and avoid maternal, infant, and child deaths. Trained midwives provide both ante and postnatal care. During the pregnancy, Malteser International midwives examine the woman's history of previous pregnancies, screen their nutritional status, and check for anemia, as well as diseases such as malaria, syphilis, or HIV. Additionally, ultrasound scans identify the expected date of delivery, possible complications, and the condition of the placenta. Follow-up visits allow for routine checkups, the administration of vaccines and vitamins, and monitoring the baby's weight gain. Trained midwives at the camp hospital conduct normal deliveries. Women with complicated pregnancies are referred to full-scale hospitals in Thailand and are transferred using a specialized vehicle provided by Malteser International. Postnatal clinics are conducted for lactating mothers. They allow for early detection of any complications for the mothers and newborns, as well as monitoring the growth of the babies, nutrition of the mothers, and prescribing various vitamins and minerals. Children in the camps are immunized according to expanded Thai immunization schedule. Midwives and community health workers also conduct vaccination awareness sessions on the vaccination schedule in Thailand and Myanmar. This helps mothers who need to bring their babies for immunization later, either in the camps or once they return to Myanmar in the future. Additionally, nutrition workers monitor the growth of the children under 5. Children who are identified as moderately or severely malnourished undergo supplementary therapeutic feeding programs until they attain a healthy weight. Recently, Malteser International has introduced mother support groups to help young women and mothers to improve their knowledge of topics such as female reproductive systems, as well as the advantages of receiving postnatal care and danger signs they need to be aware of during pregnancy. Each group consists of 15 to 20 mothers.
le ta kwe ma ho ba kwe mo ke di ko la pe ko le ba ko di ba la de ko le ba ko di ba la de ko le pe ki mo pe ki na ki de tai thwe ko thwe kwa awe tai thwe ko thwe kwa o si ko la mo la de awe
Due to the high population density, disease can easily break out and spread quickly in the camp setting. To prevent this, Malteser International has set up rapid response teams trained in disease surveillance in both camps in order to respond quickly to outbreaks. Hospital staff regularly share data on the prevalence of disease with these teams who monitor and investigate their spread. In order to avoid disease outbreaks from the very beginning and educate the camp community on how to prevent diseases, Malteser International teams also conduct prevention campaigns and health promotional activities for the refugees with the support of camp-based organizations and committees. Malteser International also works very closely with Thai government and health authorities and shares all information related to diseases and outbreaks at the camp with them on a weekly basis. Coordination meetings are held in every quarter.
ครับสำนักงานสาธารณสุขอำเภอศพเมยซึ่งเป็นหน่วยงานภาครัฐนะครับหน่วยงานด้านสุขภาพภาครัฐเราทำงานเกี่ยวข้องกับหน่วยองค์กรพัฒนาเอกชนที่ดูแลด้านสุขภาพในศูนย์อพยพก็คือองค์กร MI เราจะทำงานหลักๆอยู่2ส่วนก็คือส่วนแรกเป็นการสนับสนุนงานด้านวิชาการและส่วนที่2เป็นการสนับสนุนด้านการแพทย์ในการสนับสนุนด้านการแพทย์จะเป็นการรับส่งต่อผู้ป่วยที่ป่วยหนักในพื้นที่นะแล้วมารับรักษาต่อซึ่งโรงพยาบาลในศูนย์อพยพทั้ง2แห่งนะถ้ามีผู้ป่วยหนักก็จะส่งต่อเข้าที่โรงพยาบาลแม่เสลียงแล้วในส่วนของการสนับสนุนวิชาการเราจะดำเนินการให้ความรู้แล้วก็ร่วมอบรมซึ่งเราเป็นแค่วิทยากรร่วม
Malteser International will continue to support the refugees in Thailand living a life in health and dignity, not only as long as they stay in the camps, but also after they return to Myanmar.